As far as expectations of weight loss, we hope that patients lose around 70% of their excess body weight. This may vary a little bit based on the procedure that you have. Typically with weight loss, patients lose the majority of their weight in the first 6 months, or roughly about 50% of their excess body weight in about the first 6 months. Weight does tend to come off more rapidly in the beginning and then starts to taper off as time goes on. Patients may also hit plateaus where they go for several weeks or a month without losing any weight. That can be normal for particular patients, or it could also be something that we need to make some modifications with their dietary intake or their exercise in order to help them get over those plateaus to begin losing weight again.
So the question of excess skin after bariatric surgery is very common. My short answer to patients initially is if you have excess skin after bariatric surgery, it means you've been very successful with the weight loss process. It means you've achieved your goals, and it's a byproduct of how successful you've been. Now, every patient that has been successful with weight loss surgery will have excess skin, and how important the excess skin or how much it affects their life is an individual decision. Many of our patients, once they've achieved their healthy weight, realize that the excess skin they have is not a significant issue, and they live life with it and choose not to get surgery to address it. Other patients choose to spend their money and get plastic surgery procedures, many of which are very, very successful in achieving removal of the loose skin. But again, it's an individual decision.
Postoperative emotional changes are very common for our patients. And in fact, with patients that have never experienced depression preoperatively, about 1/3 of those patients will experience depression after surgery. So these emotional changes in mood and worry are very common for our patients. What I encourage our patients to do is to bring these symptoms up or to talk about some of these concerns with their physician or any member on the team. We then will be able to work with the patient to develop an individualized treatment plan to get you feeling better. There's a huge gap between expectations and the reality of what happens for folks after surgery. And with depression, the larger that gap is between their expectations and what happens, I think the larger chance for patients to develop depression afterwards. But they think that this is kind of the cure-all for many different problems in their lives. And so they put a lot of eggs in the surgical weight loss basket. A support person is extremely important for your success in terms of actual weight loss, but then also adaptation to changes after surgery. So there's a decreased rate of depression and anxiety and other psychological changes for folks when you have good people in your corner helping to support you through the process.
You may return to work typically after about 2 to 3 weeks after surgery. Some patients feel like going a little sooner than that. Some people choose to wait and go back after 6 weeks. We do have someone with our surgical weight loss program that can help you with fill out FMLA forms or short-term disability forms if needed.
We recommend waiting 12 to 18 months after surgery before getting pregnant. The good news is that after surgery, there's much less risk of experiencing problems during pregnancy, such as gestational diabetes and eclampsia. There are also fewer miscarriages and stillbirths than in heavy women who have not had surgery and weight loss. Kids born after mom's surgery are less at risk of being affected by obesity later due to the activation of certain genes during fetal growth. There is also less of a risk of needing a C-section.
We definitely do not recommend ever using nicotine products again after bariatric surgery. Of course, there are a lot of health benefits from that in terms of the entire body, but specifically as it relates to bariatric surgery, there are significant risks to resuming cigarette smoking or other nicotine products after the procedure. Specifically in terms of a gastric bypass, there is a type of ulcer that can be developed near the stomach connection that is associated with using nicotine products over somebody's life. And so for that reason and other health reasons, we strongly discourage or prohibit our patients from using nicotine products throughout the rest of their life.
Alcohol is generally not recommended after bariatric surgery. Alcohol contains calories but minimal nutrition and will work against your weight loss as a goal. For example, wine contains twice the calories per ounce than regular soda does. The absorption of alcohol changes with the gastric bypass and the gastric sleeve because an enzyme in the stomach which usually begins to digest the alcohol is absent, or at least reduced. So alcohol may also be absorbed more quickly into the body after a gastric bypass or a gastric sleeve. The absorbed alcohol will be more potent than normal, and studies have shown that obesity surgery patients have a higher alcohol level and maintain the higher alcohol levels for a longer period of time than others. In some patients, alcohol use can increase and lead to alcohol dependence. For all of these reasons, it is recommended to avoid alcohol after bariatric surgery.